Hi, everyone. Welcome, Dr. Hina Jawaid. So today we will be talking with Dr. Hina Jawaid about why is it important uh, to be aware of the symptoms of breast cancer. October is the Breast Cancer Awareness Month, and the talk is very relevant. So, Dr. Hina, welcome to the podcast. Dr. Hina Javed is an associate professor of family medicine at the Health Services Academy in Islamabad, Pakistan. So, Dr. Hina, in your experience, what are some of the most common reasons people delay seeking medical help when they notice breast cancer, breast changes? Sorry.
Okay, thank you very much. It's always a pleasure to be on this forum. And yes, Breast Cancer Awareness Month is November. It's for the whole month that we dedicate this for awareness, making people know about what the signs and symptoms are, and also promote research, fundraising, and help people who have survived it or are suffering from it. So, yes, I think there are a number of reasons why by we, I mean females, are a bit reluctant to come to the GP or the primary care physician or approaching any doctor for that matter. I think it's literacy, the lack of literacy. Remember, 42% population in the country is illiterate. This on top of no robust primary care system, lack of patient navigation, or any lack of awareness for that matter, puts them at the risk of not being attended to. They go into things like, oh, it's just a lump, it's probably nothing. I'm thinking too much about it, I'm worrying too much about it. Maybe they don't discuss with other females in the family, maybe. And it depends. The situation is different from ladies who are married and ladies who are single.
Mm,
Um, so then the fear factor kicks in. So the denialism happens
mm,
until, unfortunately, the lump increases in size, or it's the cancer tends to spread more and they come with other symptoms or a more advanced disease. And I think that is one of the reasons the lack of early detection, because of lack of awareness and lack of healthcare facilities appropriate and patient navigation. Breast cancers are detected quite late in the stage, and that leads to increased mortality. Now remember, cancers which have prevention screening is you identify a suspicious lump in an
mhm,
individual or identify cancer in an individual who has no symptoms. So you are
mhm,
screening the population. So a cancer which has a screening modality available, people shouldn't die of cancer. They shouldn't be presenting later at the stage.
mm,
But unfortunately, mortality rate in Pakistan is quite high because of breast cancer. Then there are cultural beliefs as well.
mm,
We like to take a consultation from somebody within the family, like a relative or a neighbor, rather than seeking appropriate medical advice from a trained, qualified medical practitioner.
mhm.
Uh, Rural-based population, 63% of our population is rural-based. So there
Great.
are
Mm,
lack of healthcare facilities,
mm,
and the affordability of treatment. Because again, remember when I mentioned the fear,
mm,
when they think of things like, oh, maybe it's not cancer, maybe it's just an ordinary lump, it's a simple lump, it will go away.
mm.
So they kind of give themselves false hope. They remain in denialism because they are afraid who's going to support them. Or
Yeah.
people who've been diagnosed, women who have been diagnosed with cancer, they have been abandoned by their in-laws, their husbands, even their own families.
Mhm,
Some ladies have been strong enough to say, oh no, I need to stand up for myself. So they've moved to an urban area with their kids, managed
mm,
to get work, find help,
mm,
and have survived. But not
mm.
every female have that level of courage or boldness or be able to face the world. So I think there's a bit of a dilemma there. So these are some of the barriers towards lack of early detection in breast cancer, I believe.
Thank you, Dr. Hina. The next question is, what puts you at a higher risk of developing breast cancer? So are there any key risk factors that everyone should be aware of?
I think being a female, the gender itself, um, so it puts you 100 times more risk than men. But
Mm-hmm,
mind you, men also get breast cancer. It's very rare,
mm-hmm,
but there it's men breast cancer is equally important and it needs to be identified earlier because it can be aggressive. But being a female puts you at a
mm-hmm,
high risk.
mm-hmm,
Females who start having period early in the life and have a
mm-hmm.
very late menopause, right?
Okay.
So at an average, the menarche or the first period, it usually comes around 12, 13 years of age. But if it comes earlier than that, and menopause, the average age is about 51 years. But if some females have periods late up until later in the life, so because you're exposed to estrogen more, age, that's a non-modifiable risk factor because
Mm-hmm,
as we increase, the risk of breast cancer increases as you go 40 and above.
mm-hmm,
Uh, then, if you previously have had a breast cancer, personal history of a
mm-hmm,
suspicious lump or a cancer, if somebody had a previous ovarian cancer or
mm-hmm,
endometrial cancer, endometrium is the lining of the womb.
mm-hmm,
Uh, in some setups, excessive use or consumption of alcohol is a risk factor.
mm-hmm,
Uh, if you have a family history or yourself had a history of BRCA1 or BRCA2, which are high risk genes,
mm-hmm,
the risk factor. But I would also like to say here, majority of breast cancers happen by chance. Only
mm-hmm,
10% are due to the family history. And in certain consultations, we have seen um, the daughters blaming their moms. Oh, I'm at high risk of breast cancer because of you. And I think we need to address this kind of the statement or the concept because we can't go on blaming the family member for a disease they got because it wasn't their fault either. And so it's important to address that majority can happen even if you do not have a family history, and only 10% of breast cancers are due to a family history. Okay, so we need to be a bit more considerate and empathetic about it. There are other risk factors like some women who never had have been pregnant or never had a child, or they had a child after the age of 30, the firstborn child.
mm-hmm,
Um, Females who use HRT, the hormone replacement therapy, which contains combination of estrogen and progesterone. Now, HRT is can be used for a lot of reasons, mainly menopause,
mm-hmm,
and it depends on the symptoms. And if some people, females, if they develop an early menopause, which is before the age or around 45, then HRT is justified to be given. But again, that carries a risk factor uh,
okay.
for breast cancer. Obesity,
Mm-hmm,
having a raised BMI, because estrogen synthesis happens more in the fatty tissues in the body. And I think there are three risk factors which I would like to talk in relation to Pakistan, particularly
mm-hmm, mm-hmm,
intermarriages, so cousin marriages, then unregulated food industry, the food adulteration also contributes. It's one of the risk factors, um, and low levels of vitamin D, um, which is it's quite prevalent in Pakistan. So these three risk factors, particularly in relation to our country.
yeah, you're very right. I mean, I was reading about it, and yes, in Pakistan we have low vitamin D. Our BMIs are increasing, and there is. Do you think that pollution also has a contributing is a contributing factor?
Yeah, the pollution is affecting the quality of air, the
Mm,
soil in which we grow our vegetables, fruits, and pollution in the water. Uh,
mm,
and I think because the pollution is not just affecting one part, it's affecting the entire environment. We talk
yeah,
about one health and the concept of one health. So I think if one component of one health is affected, it leads to some implications and complications. And I think this is all connected.
yeah.
So yes, yeah.
Thank you very much. That was really interesting. The next question is, what are the signs and symptoms? So, what are the early warning signs of breast cancer that people often miss or ignore?
Okay, we did a survey. We did a awareness session with which was attached with a survey questionnaire, and we got it published as well. I'm just going to have a look at that survey because that listed the number of signs and symptoms patients can have. And when we asked the audience what do they think are the symptoms of breast cancer, most of them said lump in the breast.
Mhm.
But I would like to emphasize here that that project gave us the idea that the obviously the awareness is lacking, not only about the awareness of breast cancer, but the different aspects of like the risk factors, how it can present, what to see, uh, how to examine yourself, and who to seek help from. So majority of the people thought it was just the lump in the breast, but it's it can present as a lump in your armpit.
Mhm.
So it can present as a discharge from the nipple, particularly if it's a blood-stained discharge or frank bleeding. It can present with changes in the skin and the area around the nipple, which is called areola. So the skin
Mhm.
can appear as, if you've seen an orange, then when the orange skin, which has got some puckering or dimples on it, it can appear like that.
Okay.
It can appear as changes in the nipple. The nipple can get inverted. The nipple can get like more moist, wet, itchy, discharge. So
Mhm.
sometimes patients come with unilateral, one-sided nipple rash, irritation, itching, or changes. So if it's not happening on the other side and it's only one-sided, then it needs more investigation. So these are some of the signs and symptoms. Um, some people present with upper back pain, upper or mid back pain,
Okay.
because remember, breast cancer tends to spread into the bones.
Mm.
So sometimes if it's gone more advanced, then they can present with back pain as well. But that's for advanced cases. Yes.
Mm. Mm. So, how can we detect it early? Because it is important to detect the cancers early. So, how important is early detection in improving outcomes for breast cancer? And how can we detect it early?
Okay, that's a good question because we can only detect or prevent anything when we are more aware about it. So I
Mhm.
would advise females to try and identify information, utilize this month of awareness because they might have seen things like buildings illuminated in pink color, or even when you're calling somebody on the mobile, there's a message going on about. Uh, Chhati ka cancer or breast cancer. So it is a constant reminder. So use that 1 month
Mm.
to make yourself as much aware of the different aspects. So there are a number of screening methods available. I'll start with the basic and the simplest one, which is breast self-examination. Um,
Mhm.
then there is clinical breast examination when you go to a clinic and a doctor examine you. Then mammography, which is a type of an X-ray, is a screening method.
Mhm.
Ultrasound as an investigation can be used, particularly in the younger females. MRI scan can be used. And then
Mm.
there are other methods which are more advanced and may not be easily available in Pakistan. One of them is called a PET scan, which is positron emission tomography.
Mhm.
But as I said, it may not be easily available. But in terms of this awareness session, I would like to say, as many women, if they are empowered with what to see in their own breast,
Mm.
self-examination, because
Mm.
if you know what is normal for you, you will be able to pick up what's abnormal for you earlier. So
Mhm.
you need to know your own body first. So it has got a very low sensitivity. Sensitivity means ability of any test, which is your self breast examination, in picking up an abnormality like a lump.
Mhm. Mhm.
Sensitivity is low, it's about 20 to 30%,
Okay.
but in a low in a setup where the in a low middle income country where the healthcare facilities are not that easily available, patients' affordability is an issue. We have to rely on these examinations.
Mm.
So what I usually tell females is to look, so inspect, look, and feel
Okay.
the breast and know which changes to look for. So if you
Mm.
know that a lump can be an abnormal, you're looking for a lump. If you know that there are any skin changes that can appear abnormal, or a nipple change that can, or a discharge, then you need to be aware of it. That's what you need to look for. And if you're worried about it, visit your doctor. We usually advise females who are 20 years and above to examine themselves once a month. Okay.
Mhm.
And it's usually immediately after the period, because before the period, breast can be naturally lumpy. So
Mm.
we don't want people to get scared, but best time is once your period are settled, then you examine your breast. Um, and then there is obviously a method that we usually advise females to how to examine. So they need to stand in front of a mirror, and remember, breast is examined in two positions. Either you're
Mhm.
sitting upright or standing, and then when you're laid, because some lumps can be missed in one position, and
Mm.
sometimes they become more prominent in other positions. So it's best to get it checked. Um, so yes, there is a stepwise process, which it's much easier for us to tell the audience when we are facing them, because it needs
Mm.
a bit of a demonstration.
Yeah.
But through pictures, we can always explain. And also there are apps. If
Mm.
you have an iPhone or an other type of phone in which you can download apps, there
Mm.
are free apps, and they have got cartoon animations in it on the process of how you can examine. So it's stepwise, and they are available in Urdu and English language, whichever you feel like. And in some of the apps, or even in your mobiles, you can put a reminder in the form of an alarm, uh,
Mhm.
in which it will either buzz or send you a reminder or a notification saying, oh, it's time to check your breast. And then you can open the app, and it will take you stepwise through it on how to do it. So it's easy, it's doable, it's a way of looking after yourself. So I would recommend this to the audience. Yeah.
Yeah, and it needs motivation also. So
Yes.
people tend to forget, although it's so important to do that. The
Yeah.
other among the other options that you've mentioned, I think self-breast examination is free, and the other options they do have a cost. In Pakistan, does the government pay for these?
For the examinations,
Yeah,
you
for
mean?
the screening. Yeah,
For the screening,
yeah.
unfortunately, no.
Okay.
At times, the mammograms are available in the public sector healthcare facilities, but they may
Mm-hmm.
not be functional. So the most that I know is privately available easily. But
Mm-hmm.
having said that, the mammograms are available in public sector healthcare facilities as well.
Mm-hmm.
Uh, for instance, in Lahore city, they are available in Jinnah Hospital, Mayo, in Mole, Lahore General Services, Social Security, Gangaram,
Mm-hmm.
Sina. So these are some
And
of the hospitals, and I'm sure
And
the
I
list.
think in PIMS also, Dr. Hina, there was the breast cancer screening facility.
Yeah,
At least when I was there, they used to say that during this month particularly,
yeah.
I think they also offer free services because otherwise it's quite costly. Anyways, that's the dilemma that we live in. So, what are the treatment options that we have? So, once someone is diagnosed with breast cancer, what are the options available in Pakistan?
Okay, so whenever anybody finds any abnormality in the breast, it's always better to get it checked by a doctor.
Mm-hmm.
And I would suggest go to somebody who's qualified so that they can advise you on what to do next. So the main types of treatment is an operation, a surgery,
Mm-hmm.
either to remove the breast or the lump. So some women worry about, oh, my breast will be removed completely. No, that may not be the case. And that is why we need access to the specialist and other hospitals, facilities to be able to get the best treatment option for you. So even if you're detected, if we tend to detect it early, we may be able to preserve the breast, and it's only the lump that is removed. Okay. So radiation therapy, which is basically high energy waves that kill the cancer cells. Then obviously there's chemotherapy. There are medications to kill the cancer cells. Then there are hormone endocrine therapy, things like anastrozole, tamoxifen. But again, these treatments are based on the findings on the type and the stage of the breast cancer. So we need to undergo a number of investigations and maybe see more than 2 or 3 doctors to be able to finally decide which treatment option suits you best, or if you need a combination of treatments. And then there is particularly targeted therapy like Herceptin, etc. So the message that I want to give through this podcast is, if you find anything worrying in your breast, always get it checked. We think of the worst, but it may not be anything, and all you may need is monitoring. But if it is something serious, we need to find it sooner rather than later. Okay. So,
Yeah, true.
so be
So,
aware,
yeah.
take action, and early detection saves life. These are the 3 key messages, basically.
Thank you, Dr. Hina, and I am one of the examples of early detection sitting in front of you. So thank you very much, everyone, for joining us today on this important conversation about breast cancer awareness. We do hope this episode has helped you understand why recognizing the sign, knowing your risk, and seeking timely care can truly save life. Thank you, Dr. Hina, for sharing your insights and expertise. And I think if there is one message we want to leave you with, it's don't wait, know your body, trust your instincts, speak up. If something doesn't feel right, like Dr. Hina said, early detection can make all the difference. So thank you very much. Until next time, we will come back with a new topic, and then we will seek Dr. Hina's expertise again. Thank you very much.
You're welcome. Bye.